What if I told you that the heaviness in your legs, the swelling around your ankles, or those nighttime cramps aren't just normal signs of aging, but early warning signals your body is sending, and most people completely ignore them until it's too late? After the age of 60, poor leg circulation quietly affects millions of seniors, yet it's one of the most overlooked health issues today. Why? Because it creeps in slowly, disguising itself as fatigue, stiffness, or just getting older. But beneath the surface, reduced blood flow can impact your mobility, balance, independence, and even your heart health. Here's the shocking part. Many doctors won't talk about it until symptoms become severe. By then, walking becomes painful, swelling worsens, and everyday activities feel exhausting. Yet there's a simple reason this happens. Modern lifestyles combined with aging muscles slow down the natural pumping action that keeps blood flowing back to your heart. And when that circulation slows, your legs suffer first. But what if you could help reverse this process naturally? What if one simple movement, something almost anyone over 60 can do, could help wake up dormant muscles, support healthier blood flow, and reduce discomfort without medication or expensive treatments? Most seniors have never been shown this, and that's exactly why this video matters. In the next few minutes, you'll discover what's really happening inside your legs as you age, why sitting too much is more dangerous than most people realize, and the subtle signs your circulation is already struggling even if you feel mostly fine. More importantly, you'll learn one powerful exercise that targets the root of the problem, not just the symptoms. It's gentle, safe, and backed by how the body actually works after. Stay with us until the end because we'll also share how to do this movement correctly, how often to do it, and small daily habits that can multiply its benefits. Many people perform exercises incorrectly and unknowingly limit their results, but you won't make that mistake after watching this. If you care about staying active, independent, and confident in your body as you age, this is a video you don't want to miss. Your legs carry you through life, and it's never too late to support them the right way. Welcome to Dr. Michael Kent, Healthy Life 50 Plus, where we break down aging and health in a clear, practical, and empowering way. If you're serious about protecting your mobility, improving circulation, and living stronger after 50, make sure to subscribe to the channel and stay connected with us. Let's get started. As we get older, blood circulation doesn't suddenly fail overnight. It gradually slows down in ways most people never notice. One of the biggest reasons is reduced muscle activity. When you walk, stand, or move your legs, your muscles act like pumps, helping push blood back up toward the heart. But after 60, many people naturally move less. Muscles weaken, daily routines become more sedentary, and that powerful pumping action slowly fades. When muscles don't contract as often, blood begins to pool in the lower legs and feet, leading to heaviness, swelling, and fatigue. Another hidden factor is stiffening arteries. In younger years, blood vessels are flexible and elastic, expanding and contracting easily as blood flows through them. With age, those vessels gradually lose their elasticity. They become narrower and less responsive, making it harder for blood to travel efficiently, especially against gravity from the legs back to the heart. This stiffness doesn't usually cause pain at first, which is why many seniors don't realize it's happening until circulation is already compromised. Prolonged sitting plays a major role as well. Long hours spent sitting in chairs, on couches, or in cars slows blood flow dramatically in the lower body. When knees stay bent for extended periods, veins are partially compressed, further restricting circulation. Over time, this habit trains the body to accept sluggish blood flow as the new normal. Even people who feel active can experience this if their movement is limited to short bursts instead of consistent motion throughout the day. Adding to the problem, aging nerves communicate less efficiently with muscles and blood vessels. Signals that once triggered quick responses now move more slowly, reducing the body's ability to adjust circulation on demand. Combined with weaker muscles, stiffer arteries, and extended sitting, this creates the perfect environment for poor leg circulation to develop quietly, often years before serious symptoms appear. Poor leg circulation rarely announces itself loudly at first. Instead, it sends subtle signals that are easy to brush off or blame on age, weather, or fatigue. One of the most common signs is swelling around the ankles and lower legs. Shoes may feel tighter by the end of the day, or socks may leave deep marks on the skin. This happens when blood struggles to move upward, allowing fluid to collect in the lower body. Cold feet are another warning many seniors overlook. Even in warm rooms, the feet may feel chilly or take longer to warm up. This isn't just discomfort, it often means warm, oxygen-rich blood isn't reaching the extremity as efficiently. Along with coldness, some people notice a pale or slightly bluish tone in their feet or toes, especially after sitting for long periods. Leg cramps, particularly at night, are also a common signal. These sudden painful muscle tightenings can interrupt sleep and leave the legs sore the next day. While cramps are often blamed on dehydration or overuse, they can also be a sign that muscles aren't getting the steady blood flow they need to relax and recover properly. Numbness or tingling is another red flag. It may feel like pins and needles, a dull buzzing, or partial loss of sensation in the feet or calves. When circulation slows, nerves don't receive enough oxygen, which affects how sensations are felt. Over time, this can interfere with balance and walking confidence. Many seniors also describe a heavy or tired feeling in their legs. Even after light activity or standing for short periods, legs may feel weighed down, tight, or difficult to lift. In some cases, the skin on the lower legs may appear shiny, thin, or slightly darker than usual. These changes often develop slowly, making them easy to ignore, but they are the body's way of signaling that circulation is struggling. The exercise focuses on something the body already knows how to do, but often forgets with age: activating the calf muscles to move blood upward. It's called the seated heel raise, and it's simple enough to do almost anywhere. While sitting upright in a chair with both feet flat on the floor, you slowly lift your heels while keeping the balls of your feet on the ground, then gently lower them back down. That small movement may look easy, but it triggers one of the most important circulation mechanisms in the lower body. The calf muscles are sometimes called the second heart because they play a major role in pushing blood from the legs back toward the heart. Every time those muscles contract, they squeeze the veins and help blood move upward against gravity. As people age and walk less, this pumping action weakens. The seated heel raise directly reactivates those muscles without putting stress on the knees, hips, or lower back, making it especially safe for older adults. What makes this exercise so effective is its control and consistency. There's no jumping, no strain, and no need for balance. The movement encourages steady blood flow rather than sudden pressure changes. As the heels lift, blood is pushed upward. As they lower, fresh blood flows back into the lower legs. Repeating this cycle helps reduce pooling, warmth returns to the feet, and muscles receive more oxygen. Because it's done seated, it's ideal for seniors with limited mobility or joint discomfort. It can be performed while watching television, reading, or resting, turning idle time into active circulation support. Over time, this gentle motion helps keep veins more responsive and muscles more engaged, supporting healthier blood flow without fatigue or risk. To get the most benefit from this exercise, posture comes first. Sit in a sturdy chair with your back straight but relaxed, shoulders down, and both feet flat on the floor. Your knees should be bent comfortably at about a right angle, not pulled in too close or stretched too far forward. This position allows the calf muscles to work efficiently without placing strain on the joints. Keep your weight evenly distributed and avoid leaning forward or gripping the chair tightly. Breathing plays a bigger role than most people realize. Many seniors hold their breath without noticing, which limits oxygen flow and increases tension. As you lift your heels, breathe in slowly through your nose. As you lower them back to the floor, breathe out gently through your mouth. This steady breathing helps the muscles relax between movements and supports smoother blood flow throughout the legs. When it comes to repetitions, slow and controlled is far more effective than fast or forceful. Begin with 10 to 15 heel raises, lifting the heels for a second or two, then lowering them just as slowly, Focus on feeling the calves engage rather than rushing through the motion. If the legs feel tired, that's normal, but sharp pain or cramping is a sign to stop and rest. For most seniors, performing this exercise 2 to 3 times a day is ideal. Short sessions spread throughout the day work better than one long session, especially for circulation. It can be done in the morning to wake up the legs, in the afternoon after sitting, or in the evening to ease heaviness. The goal is gentle consistency, not pushing limits. Over time, as strength and comfort improve, repetitions can increase naturally without forcing progress. Improving leg circulation doesn't stop with one exercise. It's supported by the small choices you make throughout the day. Light, frequent movement is one of the most powerful habits you can build. Standing up every 30 to 60 minutes, taking short walks around the house, or gently moving your ankles while seated helps keep blood from settling in the legs. These small motions remind your muscles to stay active and keep circulation flowing naturally. Hydration also plays a quiet but important role. When the body is low on fluids, blood becomes thicker and harder to move through the veins. Drinking water regularly throughout the day supports smoother blood flow and helps reduce that heavy, sluggish feeling in the legs. You don't need to overdo it, just steady, consistent hydration makes a difference. Posture is another often overlooked factor. Sitting with legs crossed for long periods or slouching in a chair can restrict blood flow. Keeping both feet flat on the floor, sitting tall, and avoiding prolonged pressure behind the knees allows blood to move more freely. Even when standing, shifting weight and avoiding locked knees help circulation stay active. Simple habits like elevating your legs slightly while resting, wearing comfortable footwear, and maintaining gentle daily movement all work together to support healthier legs. None of these changes are extreme, but combined, they can significantly improve how your legs feel day to day. If you found this video helpful, take a moment to like it. It really helps our channel reach more people who need this information. And don't forget to subscribe to Dr. Michael Kent, Healthy Life 50 course for more practical, easy to follow tips on staying strong, mobile, and healthy as you age.